Hi, hello everyone. Welcome. We're happy that you're joining us. Good morning, good afternoon, good evening from wherever you are. Welcome to the webinar Strengthening Social Contracts in South Asia in the Aftermath of COVID-19 Crisis, the Adequacy of Social Protection Responses in the Short Term, and the Future Role of Universal Social Protection. My name is Luiz Moreira Daniels. I am the Chief of Social Policy at UNICEF Sri Lanka, and I have the pleasure, the honor to be moderating and welcome all of you to this webinar today. So this is a webinar that is part of a series of webinars that socialprotection.org has been putting together, a series called Social Protection Responses to COVID-19, which is a joint effort initiated by the International Policy Center for Inclusive Growth, IPCIG, with GIZ on behalf of the German Federal Ministry for Economic Cooperation and Development, BMZ, and the Australia Government's Department of Foreign Affairs and Trade, DFAT, in collaboration with socialprotection.org platform and in cooperation with partners from different organizations. So this webinar series that they've put together is part of an initiative with two other major components. There is a collaborative mapping of country news and documents disseminated weekly through a dedicated newsletter for this topic, and an online community on the topic to systematize information and foster discussion. If you're not part of that mailing list and that the mailing list yet, please join Social Protection Responses to COVID Task Force to learn more about the initiative and to be updated and to be able to collaborate and to know about future webinars. Also, this is the second webinar of a series called Social Protection in South Asia, the landscape before COVID-19 and a snapshot into responses to the crisis and the paths ahead, which is jointly organized by IPCIG and the UNICEF Regional Office for South Asia, as well with country offices in the region. So there are some future webinars of the series coming up. The next ones on social protection responses to COVID-19 will take place on June 30th and July 2nd and July 7th, and we'll focus on migration, universal health coverage, and adaptation of cash transfers in Latin America. So very, very interesting topics. Don't forget to register. And also stay tuned for the next webinar of the South Asia Social Protection series, which will take place on 23rd of July. So those are some of the housekeeping information. And today we will be joined by some fantastic speakers that don't really need a whole lot of introduction, that has been working in this field for many years and that most of you probably know well. So I'm joined by Mr. Abdul Alim. He is UNICEF Regional Social Policy Advisor for South Asia. He's been with UNICEF for probably longer than he cared to share, for over 20 years, working for children's rights. His major interests are in human rights-based approach, to policy, to see policies happen. And you have his little bio here. So just to give you a little more information about who Alim is beyond what's on the screen, I just wanted to say that Alim is originally from South Asia and that he believes that social protection is a great instrument to revamp the weak social contracts that he sees in the region. He still gets a bit frustrated, like all of us do, in the work on social protection, particularly because he feels that decision and policymakers still do not take it seriously, or at least not as seriously as they should. So that's a little bit of a link for you. Then we'll also be joined by Fábio Soares, who is an economist and researcher at IPCIG, who as you can see, also has a long history of working in social protection. And what got him hooked into this area of social protection, he's dedicated so much of his life to it, were the changes that he saw in his home country of Brazil since the enactment of a new constitution in 1988, when he was still in high school. He was a high school student, but that change made Social Security and social protection a right and paved the way and the funding to build a more comprehensive social protection system. That's what got him hooked on social protection. And again, one of the things that frustrates him about the work on social protection is when people refer to it as charity and not as a collective investment in social cohesion and human development and inclusive growth that it is. So that's Fábio Vera Soares for you. And finally, we're also joined by Stephen Kidd, who's also been working on social protection for over 3 decades, in DFID in the past, HelpAge, and is current CEO and senior social policy specialist at Development Pathways. One of the things that makes Stephen particularly proud of in his work in social protection is the support that he was able to provide to the government of Kenya, which resulted in the government there putting in place their first flagship universal old age pension. So that's something that makes him proud of his work in this area. And one of the things that does frustrate him is the claim that many make that there is no fiscal space. For him, that is rarely, if ever, true, but nevertheless is one of the most common arguments used by those who oppose universal social protection. And for him, that shows a limited ability to think outside of the box. So these are fantastic speakers that are here with us today. I'm very excited to be here, bringing this discussion with you. And just to briefly mention that this webinar came particularly from a lot of work that UNICEF at regional level and country levels are doing with Development Pathways, with IPCIG, even before COVID. We've been working with these 2 powerhouses of social protection to really try to strengthen social protection in the region. And with the advent of COVID and all countries trying to respond and UNICEF trying to provide the right advice, sound advice on the go to governments, we rely and continue to rely a lot on these amazing thinkers and doers in social protection. So this webinar is part of this collaboration, and trying to get some answers to difficult questions that we're having right now in the world of social protection and how to respond to COVID in the best way. So just to let you know, give you a little bit of information about the dynamics of the webinar today, because as in social protection, predictability is quite important. So we will have the 3 speakers. Each of them will give their remarks in 15 minutes or less. And after that, we will move towards, we will have 30 minutes of questions and answers. Nevertheless, please, throughout the webinar, you are able to post your questions on the chat box. And we will get to them once the last presenter presents their presentation. Well, last presenter presents their presentation. Please, I would like to encourage you to address your questions. If you'd like to address to a specific speaker or panelist, please mention there. And if we're not able to answer all of the questions, please know that we'll be putting together a Q&A after the Q&A session. We'll be putting together a document that will be shared with the audience and also available at socialprotection.org a few days after this webinar. So without further delay, I'd like to once again thank all of you for being here and passing the word to Abdullah Lim. who will talk to us about the structural deficiencies in social cohesion that characterize South Asian societies, South Asian countries. Alim, over to you.
Okay, thank you, Louise, for a very detailed opening and introduction. I am going to try and build a bit of a context before Stephen and Fabio speak about the more current day realities and what can be done about it. And I want to just make a couple of critical points about South Asia. One of them is looking into the political history of South Asia, because I think the formation and the issue of how social contract has shaped in South Asia relates to the evolution of the state in South Asia. And most of you perhaps already know that South Asia is one of the youngest regions, with one of the youngest countries in the world, over about 75 years old, starting in 1947 when the British left. And the one of the important things to note here is that the whole idea of social contract comes from the idea of nation state. But in South Asia, what we have is essentially, when the British left, we were left with the state nations, not a nation state. And that's a very, very important point to note, because the evolution of the state in South Asia is more determined by what happened in the beginning, in the sense that border lines were drawn and the British left with the governance mechanism left in the hands of the local populations. But what is very different from other countries in Europe is that most South Asian nations are actually multi-ethnic and multinational. So what we have is this multi-nation states, not a nation state. And these are state nations, which makes the evolutionary process of state building in South Asia very different from what one would consider the normal path that the European states have taken. Now, one of the things that is really critical to note here is that South Asia also remains one of the lowest integrated regions in terms of internal intra-country trade. Just a comparison, that there's only 5% trade within South Asia as opposed to 25% among ASEAN countries. So the early history, political history of how countries were formed actually have determined to a large extent the intra-country or the international relations between South Asian countries, and that has affected the well-being of most of the people in South Asia. And obviously, one of the other important things to note here is that we are still in the state of national identity formation, because we are dealing with so many different ethnic and religious and national groups, that the nature of dialogue and democracy remain very, very different institution in South Asia. And that has implications for the dialogue or the formation of social contract that we will talk about, and what remains a largely contested issue in South Asia. Now, that's a bit of a political history. I think one important point to note here is also that when the colonial rulers left, they left us with a legacy of extractive institutions by creating a class of people who were to govern South Asian countries. And unfortunately, to a large extent, no reform, no radical or deep reform has been done to this kind of extractive economy, which remains persistent and also actually creates a weakness within the fundamentally within the economic and financial health of the South Asian countries. Now, why do I say that the state of social contract in South Asia is very weak? Is because there are 3 or 4 things that I believe are clear indicators of a very low level of, or a relatively low level of trust between citizens in the state. And that is really reflected in low tax to GDP ratios, very high level of informal workers, almost 70 to 75% unemployment in South Asia is in the informal sector, and a consistently low social spending, including very low social spending on social protection, except perhaps Nepal. But the overall expenditure on social protection in South Asia remains well below 4% as compared to many regions. So if you look at the current context, and what COVID has started to do is actually to just open up the fissures that were already actually showing up in South Asian economies, despite a very high level of economic growth over the last couple of years. the investment in social sectors remain one of the lowest in the world. An example of that is the health sector investments. Health sector allocations in South Asia have remained below 1% of GDP in most South Asian countries. And that has led to a sort of what I call privatization of a public service. So, for instance, in India and in Pakistan, almost 75% of health expenditure comes from out-of-pocket expenditures for people, which again is a real important factor in terms of empowering people, because public services have really given up their responsibility to take care of social welfare. And and one of the other things that to note is that this has led to the transformation of even healthcare systems into a healthcare industry, which puts people's lives into a lot of difficulty. Now, with low social expenditures consistently over the last couple of decades, we have eventually gotten into a situation where I believe we have reached a low development equilibrium, in the sense that low social development expenditures and social protection lead to very low levels of human capital growth, and then that leads to, again, low taxes, and therefore a vicious cycle of low tax, low domestic revenues, and again, lower social development expenditures. So South Asia is in this what I call a vicious cycle of low trust, weak social contract, and a low development equilibrium that it has not been able to escape from, and is determining most of what is happening to it, just because of the extra stress that COVID has put on. And I believe that COVID is essentially exposing the fault levels within societies. One of the important developments that you will note, and I think Stephen will speak about it, is the fact that due to very low levels of employment opportunities in South Asia, one of the largest exports in South Asia is actually low-skilled workers to surrounding countries like Middle East and other parts of the world. And South Asia is dependent very largely on very large amount of remittances from these other regions. And in some cases, this reaches up to 30% of GDP. For instance, in case of Nepal, 30% of GDP in Nepal is made of foreign remittances. So you can see how the low trust between citizens and the state actually plays into developing a weak social contract, and develops this sort of what I call a vicious cycle that South Asia has sort of got trapped in and is unable to actually walk out of it. Now, the question, therefore, some people can ask is, why does that happen? Because in many countries in South Asia, we still have democracy, and why can't people really find the ways to actually address this process? And I believe that has to do with both the extractive colonial institutions, and also the way our political and social hierarchies have remained entrenched, which doesn't leave much room for true representation, and therefore there is only partial representation of public interest in our governing institutions. And I think that complicates the whole issue of how we can actually address the issue of social contract and building the trust between citizens and the state. So just to end with one last point, which is to say that this COVID emergency or pandemic has actually exposed these large social and economic fissures in the South Asian society. We are now looking at more and more issues of division, social incohesion, and we have the first few instances where we have had riots, and most of you know what happened when India went into a lockdown and lots of migrant workers were left in limbo. In Nepal, we have had now starting the protests in streets of Kathmandu, where people are responding with some violence to government policies on the lockdown. I think we are looking at now the issue of how do we really solve this issue, and how do we address both the COVID emergency and also the long-term issue of building a social contract in South Asia. And to me, there is no doubt that one of the ways to actually build the trust between citizens and the state is for the state to start looking and looking trustworthy to the citizens. And one of the ways to do it is actually to start inclusive social protection systems which allow people to understand that actually the state is interested in their welfare, and is able to give them a bit of a predictable cushion into the daily life problems that they are facing in terms of not being protected because of being in the informal sector or high unemployment because of the lockdowns. And so I believe that Stephen and Fabio will now speak to the whole issue of how one can actually address the whole issue of building trust between citizens and the state in South Asia through instituting universal, inclusive social protection systems that can create the environment that brings South Asia out of this vicious cycle and put it into a virtuous cycle of high trust, people paying taxes, therefore higher level of social spending, and therefore higher human capital and good economic progress. I'll stop here and thank you so much. Over.
Thank you, Alim, very much for your considerations. We will move now to Fabio, who will walk us through some of the core epidemiological and macroeconomic impacts that COVID-19 is having in the region or expected to have in South Asia, and on the extent to which the current short-term social protection responses that have been put in place in the region can be considered adequate to their contexts. Fabio, over to you.
Okay, good morning, everybody. Thank you very much, Liz and Ali, for the introduction. Good morning, Stephen, as well. Good to have you to share these two presentations for the work that both Development Pathways and the IPCIG are doing for UNICEF Regional Office in South Asia and also for different country office. As Luis mentioned, there are a couple of knowledge products and working papers and briefs that we have developed even before the crisis. But this presentation is going to focus actually in a policy brief that we have done for that we are doing. Actually, it's the second draft that I'm going to present that we are doing for the UNICEF Regional Office in South Asia. That basically will look at that will look at three aspects. So the first one, the first aspect we are going to discuss is to show a little bit quickly the epidemiological and socioeconomic impacts of the COVID-19 in South Asia. We are also going to map to show some of the macroeconomic and social protection measures to respond to the COVID-19 crisis. And in the end, and related to the discussion around the social contract that Ali has proposed to us, to look at how the so-called missing middle, that are basically the informal workers or the unpaid workers in South Asia, can be covered by social protection. And then in the next presentation, I think that Stephen is going to deepen a little bit the policy options around implementing universal social protection in South Asia. So starting a little bit with the epidemiological and the socioeconomic impacts of COVID-19, and here's not only the impact of the social crisis, but also the economic consequences of the health crisis and of the measures that were taken and they are still being taken to control it. So the data we have here is a little bit already outdated, so it's from 11th June. Does show that the cases in South Asia are increasing. So South Asian countries haven't been at the center of the pandemic yet, but the projections show that the number of cases are increasing. If you look at India, for example, yesterday, the figures that we had for India are the double of the figures that we had in 11th June here. And it's the country with most of the cases, of course, that's led also by the size of the population, followed by Pakistan and then Bangladesh, so the three most populous countries in the region. So in face of the globalization of the spread of the COVID-19 disease around the world, so first it started China, then the epicenter moved towards Europe, to South Europe, to the UK, then it moved into America, North America, with the US leading. And now, most of you must know that Latin America became the epicenter of the disease. So as the countries in South Asia observed the evolution of the disease, they have taken several steps to promote the measures, the non-pharmaceutical interventions that have been recommended by WHO, by the World Health Organization, to avoid overburden fragile healthcare systems. And actually, in terms of a pandemic, it's not only fragile healthcare systems. So all healthcare systems in the world can be burdened by this high surge in demand for healthcare, especially on the intensive care units. So these are some of the indicators that countries have been looked at in order to decide which type of response and which type of social distance they have been implementing. So it has varied a lot across countries in terms of the stringency and the timing of the implementation of these measures. The typical measures include the closing of schools. We've seen that all countries in the region have closed the schools. Even countries that didn't go into full lockdown have closed the schools. We've seen also the cancelling of large public events, the closure of workspaces, and that's quite important for us. We're going to see that some of the indicators that we're going to present that we took from the ILO methodology that they have been used to classify the hard hit sectors actually put lots of emphasis on these mandatory closure of workspaces. And also the suspension of public transportation, and that has a huge impact also on informal sector workers. So here's just, we present the Oxford Stringency Index. That's the index that many people are using to show how strict have been the containment measures. What we can see here is that the countries have, as I said before, they have adopted these measures with different timing. But we can see that South Asia, by the end of March and mid-April, most countries were around or above 8% regarding the Oxford Stringency Index. That shows that very tough measures have been taken to avoid the spread of the disease, and that has had implications for the economy and also for the livelihoods of the population. We are going to see here, I would like to highlight two cases, India and Sri Lanka, were the two countries that actually for this index, they have reached 100. So the maximum closure that we can say it was a full lockdown was reached by these two countries. But we also saw it for other countries, such as Nepal and Pakistan, and even Bangladesh, that were quite high. Bhutan and Afghanistan were the two countries with the lower stringency index, so they did not adopt a full lockdown. This index is not available for the Maldives, but the revision of the Google indicators that we have been looking at and the revision of some of the measures taken by the government, Maldives is another country that we can say that an almost, if not a full lockdown, almost full lockdown has been implemented in the country. So as I said, so these containment measures were quickly scaled up from mid-March until the end of May, actually. So India, Sri Lanka were the two countries where these measures were more stringent. But by the end of May, most countries will take some flexibilization. So if you look here, so the level of the stringency index starts to fall, but we are not back to the normal yet. So it means that some restrictions are in place. For example, if we think on women's labor force participation, then the fact that the schools are closed put an extra burden and actually impedes or make it much more difficult for women, especially women, to go back to the labor market. So there is still some supply shock working around these policy measures. And finally, there was a debate, and Aline mentioned it a little bit, on whether these policies or these measures should be taken in a general way or whether they should be taken in a smart way. And that's a little bit of the debate that we also saw in other parts of the world, and the debate in that South Asia, particularly India, people were discussing the trade-off between life and livelihoods. and how the government should balance these two aspects. So there were like lots of criticism around what some governments, especially those who adopt a strict lockdown, did in terms of avoiding the population movement that basically impedes, forbids some people to actually have access to their livelihoods. So in terms of the economic consequence, how we can think about the COVID-19 and how this thinking of this theoretical framework can help to think on what are the sort of policies that need to be implemented to try to mitigate the impacts of the negative impacts of the COVID-19 crisis. So the first thing to note, and that has been highlighted, was basically it's a negative supply shock. So many sectors of the economy cannot operate under the lockdown, and many people cannot actually provide their livelihoods without the possibility to go to work, or the possibility to have access to venues where you have large amounts of people get together so that you can provide your service. But beyond the supply shock, we also have a negative demand shock that can come from trade. It can come, for example, for the tourism industry. That's quite important for some countries in the region, at least for 3 countries in the region, for the Maldives, for example, but also for Nepal and Bhutan. This decrease in the demand for tourism may lead to long-term or medium-term consequences and spread the crisis for a longer period. Also, the decrease in the demand for some of the exports in the region, we think here of the garment manufacturing in Bangladesh, for example, it has been severely hit. But also, the supply shock leads to a demand shock as incomes and remittances, for example, goes down, as already mentioned by Ali. So you also have a negative impact in terms of the internal demand. So it's not only the external demand with this shock that's so far has been stronger outside South Asia, but also the internal shock with the decrease in consumption of remnants because the income goes down. And on top of that, we still may have, or we still are seeing a global financial shock as capital withdraws from emerging markets, and increase in the cost of the interest rates, and currency depreciation because of loss of faith that the countries will be able to respond. Because of that, the IFIs, especially the IMF, at least for 4 countries already, they have had this special, the fast track to get some credit lines to build confidence on the capacity of the state to respond to the crisis and also to pay loans. So as you can see, these shocks are interwoven, so they are interrelated, and especially the second round effects, there are lots of uncertainty around them, around the decrease in the demand, and also on the capacity of countries to access financial markets and to finance the fiscal policy side, and to have liquidity to pay the loans and debts. So it may be that the economic outlook of the region, on top of this first supply shock, will linger for much longer than we have been expecting. And now I'm going to show a little bit of the projections that have been put forward relating to the impact on economic growth in the region and also on poverty rates. One caution note, and I'm citing here Branko Milanovic, is to bear in mind that given the uncertainty of the development of the pandemic, so that's something that economists are not used to. So we started discussing that we need to flatten the epidemiological curve and then take measures to flatten the recession curve, but actually we don't know how this epidemiological curve or the pandemic curve is going to play out, if we're going to have successive waves, if it's possible just to attenuate the first wave and then go down to a lower level steady state that's manageable by the healthcare system, or whether we are going to have to put back some of the measures when we have new cases or new dissemination of the disease, as we are seeing now, for example, in Germany. with the necessity to go back to partial lockdown in some parts of the country. Growth-wise, the region was very dynamic before the COVID-19, so growth was almost around 5%. The projections were very optimistic, especially, for example, for Bangladesh. Even in the case of India, that was accelerating, there was some good projections in terms of the growth of the economy. And actually, South Asia was growing more than the global average, and more than the average for the emerging developing economies. So what we can say about this, having this caution in mind, what we can say about the projections. So what we have observed, and the projections are coming every day. So yesterday we had new projections from the IMF, but here we're going to concentrate on projections from the World Bank and some of the ADB. So we have identified some optimistic bias on the earlier projections, and mostly because the pandemic hasn't arrived in South Asia at the time of these earlier projections. So it was basically seen as an external shock and not as something that was internal because of the supply shock and the internal demand shock that we're observing now. And also many of them have relied on the assumption that the recovery after this recession caused by the supply shock would be a V-shaped. So the recession could be very steep, very deep, but countries would get out of the recession very quickly. We're going to see that these projections now have been revised a little bit on the experience that has been of the struggling major economies that we are seeing around the world that were first hit, but also because people are realization that perhaps the tourism industry won't recover so fast, and the impacts on import products and on remittances may last longer than what was first predicted. So on this slide, you can see here the baseline was the World Bank projections from January. We see everything is blue. So the projection for 2020, for example, was above 5% for the whole region, 6% for 2021. We can see like Bangladesh and Nepal and Bhutan for 2021 with high predictions of high growth rates. Then the first projections that we have had after the pandemic arrived in the region was from the ADB. And we see here that it was basically thought as something external. So the country that would be the hardest hit would be the Maldives with -3% in this prediction, because we're just thinking of this, the halt in tourism. Tourists were not coming to the country, but the other countries were still with positive growth projections, despite having some of them even with higher levels than before compared to the World Bank. But it's important to bear in mind that that's IDB, the other ones are World Bank, so that they have different methodologies. The two latest projections of the World Bank, we can see that now we go into recession in many countries. Maldives is still the country that was hit. But if we go to the June projection, then we can see that when finally the overall region is going to have a huge recession. And then basically also now India is forecast to have a recession for 2020. Even though, and also for the recovery, right? So the V-shaped hypothesis is not there anymore. So for 2021, we can see recovery in most places, but the very low growth rate. So we're expecting a very difficult situation for the next two countries. That's going to have implications for the poverty, also for the poverty estimates. So we're expecting with the reduction in economic growth and the growth of the population size, the capital consumption is going to decrease, so we are going to have increases in poverty rate. That's going to range between 1.8 percentage points to 2.3. But regardless of the case, we can see that South Asia is projected to account for the largest share of the increase in global extreme poverty. So that's the conclusion from the different estimates that have been put forward by the World Bank, by WIDER, and also by IFPRI. In the case of IFPRI, it's interesting, it was one of the first forecasts to come out, and they have used a general equilibrium model to try to incorporate the dynamic aspects of the fall of the consumption in in the region, but also worldwide, since they have done a global comparison. But it's important to also to bear in mind that even before the crisis, South Asian countries have different levels of poverty, so the impact is also depends on the baseline, the initial state of poverty rates. So we are going to have some countries that are going to have, in percentage terms, huge increase, but actually they are responsible for smaller parts of the new pool coming into the new population that became poor because of the crisis. So you see projections of increase in poverty headcount for all countries. So the pre-COVID is the dark orange, and the light orange is the post-COVID, is the addition to the number of extreme poor in the region. And that has obviously implications for the SDG 1, and many countries will have a huge challenge to get to reach the targets for the SDG 1. But as we saw in terms of the projections for GDP growth, as we saw that they became more pessimistic over time, we can see the same thing here for the projections related to increase in extreme poverty. So here you can see this vertical bar in the end is actually the latest projections with the pessimistic scenario from the World Bank, that's the World Bank data, and we can see how when time passes by, how the projections are getting worse in terms of the increase in extreme poverty, which reflects a little bit the GDP growth. In terms of impacts in employment, so ILO has done lots of work on this. There are lots of policy briefs that are coming out and mostly trying to look at the differential impact that the COVID-19 response and the whole crisis has had in sectors. So sectors are affected differently. There are high-risk sectors, there are medium-risk sectors, and sectors that are fewer, less risk than others. So here we can see, for example, wholesale retail trade that employs lots of informal workers, but also restaurants, accommodation, high-intensive, labor-intensive sectors are due to be high-risk sectors in terms of the employment impact of the COVID-19. And also the fact that there is high prevalence of informality that ranges from 50% to 95% in the region, as Alan also highlighted in his presentation. So here we can see the distribution of employment. We can see that the high impacted sectors and the medium high to high impact sector, in some countries they comprise almost 50% of the total employment. So that shows the risk. Here we see the share of informal in total employment. Perhaps just at the Maldives and Sri Lanka with the lowest informal employment share, but for other countries like Afghanistan and Bangladesh, we have, and even India, we have very high, almost above 90% informal employment. ILO also has made some discussion on the share of highly affected, significantly affected informal labor in the total informal sector, looking at the sector exposure, the size of the firm, or size of the business, and the stringency of the lockdown, business closure. And at least for the timing of the lockdown, of the strict lockdown and partial lockdown, we've seen that more than 90% of the informal sector workers were significantly affected by the measures. So how the countries have responded to this in terms of the monetary and the fiscal policy? So the central banks have actually acted quickly to provide liquidity and financial relief, first to the firms, so to prevent bankrupt and to prevent firms to lay off the workforce, but also trying to prevent households to go short of cash to pay their debts and also to pay the costs of health. But we know that for households, the social protection measures were much more important than the monetary measures taken. So the most common monetary measure policy taken was the reduction in policy interest rates, but we also have policies that are not necessarily implemented by the central banks to increase liquidity in the economy, like the temporary flexibilization of loans, so people can take more time to pay the loans, or they freeze the interest rates, or they don't need to pay the interest rates, and also to channel credits for the small and medium enterprise to try to avoid that they fire the labor force. So here we can see the measures. So we have the reduction in the interest rates of 5 out of the 8 countries, but some sort of monetary policy has been adopted by all the central banks to try to stabilize the economy, at least in monetary terms. And also the IFIs came to ensure that the countries would have access to external resources to be in a better position in terms of the liquidity. And also the policies taken to enhance credit and liquidity in the economy to avoid the worst effects of the crisis. In terms of the fiscal response, we have basically the most important one was increasing the health spending. So almost all countries have done it, but also deferral and reduction on taxes, and also on debt service for firms, but also we are going to see it as a social protection measures for the self-employed workers. I can see that I'm going beyond the time that I have been allocated. So let's talk a little bit on the social protection response. We have seen different types of response in terms of increasing the coverage of social protection, and the increasing coverage here was done either through existing programs, even though we have a limited coverage of programs, they have increased the coverage, and also the introduction of temporary new schemes that in many countries are being prorogated, given that the crisis, as we saw, has not reached its peak, so has not vanished yet. So we have had measures on the social insurance and the labor markets, on the social assistance. In terms of the labor markets, I think that the most important one, so the dark blue and the green shows where the policies were taken. So employment protection, we can say, was taken basically everywhere. Some support for the self-employed workers were taken in some countries, in 4 out of the 8 countries, but actually the response that was mostly spread across, most adopted across countries, was the implementation of cash transfers, of emergency cash transfers, either through the vertical or the horizontal expansion, followed by in-kind transfers and subsidies. Who are the groups that are targeted by the social protection response? So basically the workers, so the workers that have been affected by the COVID-19 crisis, and both formal sector workers through the social insurance measures, but also the informal workers through the emergency cash transfers. So the poor and the vulnerable are still a category that has been targeted by these programs, and to a lesser extent, some life cycle categories like children, the elderly population, and women. But here, mostly focusing on nutrition programs, especially for the elderly, for women and for children. And how the coverage of this response was increased. So basically, as the programs had a very low coverage in most countries, they had to rely on extraordinary enrollment that was done either in person or remotely using ICT, especially mobile phones. We can see that 7 out of 8 countries have done this when people are required to register themselves, and 3 out of the 8 countries have also used the remote and technology to implement this. In terms of the adequacy of the transfer, here we can see what's the percentage of the transfer that was given to the families in terms of the average monthly household income, and in terms of the average monthly income of the poorest expenditure quintile. So basically, we can see that it varies a lot, but what I would like to draw attention here is that in the cash transfer literature, a rule of the thumb says that the transfer should be between 15 to 20% of the monthly household income of the poorest quintile. And you can see that at least in 5 of the 8 countries, that rule was respected. Even though in terms of the average monthly income, you can see that the transfer is quite low. So it's not really replacing the consumption of the expenditure of the family, but it's alleviating the shortfall in terms of income during the crisis. The problem here is that most of these programs are temporary, so these increases are not going to last for a long time. On that slide, I would just like to show you what's the current coverage of the flagship social assistance program, so the non-contributory one, and we can see that Sri Lanka here has the largest coverage. And it's important to highlight that Sri Lanka was one of the countries that was able to respond very quickly and to expand the coverage of the program. So the estimates from Development Pathways, for example, shows that 70% or 69% of the households have been covered by the emergency response. And in the first decile, that goes up to 97%. So here we can see clearly that the countries that already have some form of social assistance, especially those with the large coverage, were able to respond much quicker to the crisis. In terms of the social insurance, one of the aspects that we saw is that social insurance is very limited in the region. So we have the ILO World Social Protection Report that shows that. It increases in tandem with the share of formal employment. So it's quite important to foster formal employment, and alongside with that, to have active contributors to social insurance. So Maldives is the exception in the region. But for most countries, and if you look to Bangladesh, for example, it's very low in terms of the formalization of the workforce and contribution to social insurance. So social insurance is very limited in terms of the impact to respond to crisis, idiosyncratic shocks or corporate shocks in the case of the COVID-19. So we have been talking a lot about the missing middle. So here we have some data from the World Bank, the Aspire database, to just show you how we have some coverage for the poorest quintile, the light green, and some coverage for the so-called well-off, the richest quintile, or the 20% richest in terms of the expenditure in the different countries. So this U-shaped does show that the quintiles in the middle of the distribution, they are less covered either by social insurance, as we saw here. So we have very low coverage of social insurance, but also by the social assistance programs that are, especially in this region, they are only poverty targets. So they don't allow for vulnerable population, for those in the informal sectors, to have access to regular cash transfers, or at least to be secured against some contingencies or some shocks that they may have during work. So how to reach the missing middle? So we can think of two strategies. So ILO and even the World Bank have been working on these strategies. So it's important, as we saw, to provide, to extend social protection floor, and the social protection floor can be the basis to provide emergency social assistance in case of this type of corporate shock as the COVID-19. And here we have policies such as universal child grants that Stephen's going to talk more. It's one kind. We only have universal child grants, for example, for Nepal, but the coverage in terms of age is quite low. So, and even for Nepal, it's important to highlight that the UCG was not used as one of the instruments for the response. It would be good to have a debate around this. And also to respond to the crisis, it's important to use the complementary policies like the expansion of universal ID, unifying social registry, and improve access to bank so that people can have access to the transfers. So these are complementary measures that need to be taken for expand the social protection floor and to respond to the crisis.
Taking the role of me moderator, I'm just asking you to wrap up so we have time for Stephen and thank you.
Okay, thank you. So in the second strategy is basically to extend social insurance to informal and self-employed workers. We have very few experience, mostly in India and Sri Lanka, around this formalization of informal employment. So here's a little bit how ILO has been thinking around this. So you would have the social protection floor for the basis to have a minimum level of protection. And here we can see that it will be universal across the pool, the informal employment, and also formal employment, and also the extension on the blue bar of formal of social insurance towards the informal sector. So that's the concluding remarks, Luis. Just finished. So it's important to think around universal, quasi-universal programs to include the missing middle, take into account the that they don't have capacity to contribute, or they don't have the truth, to go back to Alim's argument in the beginning, that they need to build this trust so that people can contribute to the systems. But perhaps one first step is actually to provide these universal programs, so that the belief and the trust in the state and the sense of social cohesion can be built. The other thing that's important is that most of the social security packages that are offered to informal workers that are not poor do not have specific contingents, for example, family and child allowance. Usually they are not part, and that's something quite important for UNICEF, for example, to look at how to ensure that all children and all families are covered in terms of regular social protection. So in our view, and the conclusion of this review is that the policymakers should consider both the expansion of the social protection floor, but also the extension of social insurance schemes to cover the missing middle, and basically to ensure protection for the informal sector workers that have been actually hit by the crisis, and the countries have been caught short of instruments to address their needs. Thank you very much, and sorry for speaking more than the time that I was allocated to. Thank you, Luis. Over to you.
No, thank you, Fabio. This is the problem when we have a lot to say, but this has been fantastic to understand what's happened in the region. Now I'll pass the word to Stephen Kidd, who will present ideas on and make the investment case for universal cash transfers in South Asia as a response to COVID-19 and beyond. Stephen.
Right, thank you. I hope you can see my screen all right. Yeah.
Yes.
So, yeah, what I'll be presenting is basically some work that we've been doing with UNICEF, both in a number of the UNICEF offices in the region and with the regional office, and looking specifically at the potential of universal social protection to begin to strengthen the social contract in the context of the COVID-19 crisis. So, we've talked a bit about the social contract. For those, if we see it in a simple way, it's a contract between citizens on one side and government on the other. It's about citizens contributing to the nation in the expectation of receiving high quality public services from government. That's the basis of the social contract. The problem that you have is that when citizens don't receive the high quality public services, then the social contract begins to disappear, and they become much more reluctant to not contribute through taxes, etc., to the state, which then gets into a vicious downward circle of low levels of government revenues. And this, as Alim had said, this is what we see across South Asia. This is just 5 countries of South Asia where you can see very, very low levels of government revenue, incredibly low in countries like Bangladesh, Pakistan, and Sri Lanka. The one that is pushing up to a higher amount is surprisingly the poorest country in the region, Nepal, at above 25% of GDP, but others down to 10%. Really, you need, I would say, a minimum of 35% of GDP in government revenues to provide a well-functioning state with decent public services. And all South Asian countries are well behind on this, and this shows the weakness of the social contract across the region. The other thing I think we have to bear in mind, sorry, a lot of noise on this slide, is the fact that really virtually everybody is living on low and insecure incomes across South Asia. These are just graphs of each country showing poverty, showing the numbers of people living under different international poverty lines and purchase power parity by color. I don't have time to go through them to explain. And alongside the little people that we have there for each country, what that actually translates to into real dollars, now through normal exchange rates in that country. And just to give one quick example, India, where we're talking about, a progressive economy growing, sending people to the moon, actually around, over 85% of the population are living on less than $1.40 a day in actual dollar terms. So the vast majority of people in South Asia are really struggling and would need access to social protection, and therefore in a very, very vulnerable state when hit by the COVID-19 crisis. They didn't have very, very far to go because they didn't have many reserves to to draw on, and this is where we find catastrophic reductions in income in many countries. And as we've heard, about the social protection systems in South Asia, fundamental problem of South Asia, there's a sort of bifurcated system, should we say, where you have at the very, very top, for those in the formal sector, mainly those in the civil service, and some people in the formal economy, you have programs much better funded, higher transfers. Then you have social assistance for the very poor, those living in extreme poverty, for those at the very, very bottom, with very low value transfers, with very, very little impact that they're having. And right across the middle, you have this missing middle, the precariat, those who live in very vulnerable terms in the informal economy, with by design no access to a social protection system, although they absolutely need it. And that's not going to give them a great sense of belonging to the state if the state is excluding them from the good quality services, which are only given to those at the very, very top, who many other services have moved off to the private sector. And so the levels of spending on tax finance social protection in South Asia are really, really low. This is just comparing across with some other countries in the world that we see in India, Pakistan, Bangladesh, and Sri Lanka. Very low levels of spending, around 0.3% of GDP maximum. Tiny amounts, very small programs that are there. There is an exception with Maldives, which has more, because it's begun to move into universal programs, universal pension, universal disability benefits. And then the star of the region, the poorest country, Nepal, which is spending 2% of GDP almost on social protection, mainly on universal old age pensions and disability benefits, and beginning to put in place a child benefit. But interesting, the poorest country, the best system, the one that's beginning to give coverage to the missing middle. And that's important to bear in mind as we move forward in the discussion. And of course, for the programs for the poor in South Asia, they also are very poor quality. We can see that in the very poor targeting effectiveness of these programs for the poor, these poor relief programs, where if we look on these different charts of some of the largest schemes in the region, and you look at the targeting effectiveness of them, we're looking from the poorest to the richest on the x-axis, and all those under the black line are those actually accessing these different programs. And you can see very high exclusion rates. Really, if they were accurately targeted, everybody to the left of the red line is the eligible population, and they should be getting it. But we find errors in Bangladesh on the old age allowance of 59%, similar in Sri Lanka with Samuri, 58%, sort of their poor relief program there, old age pension in India, 68%, and then Pakistan's Benazir income support program, despite substantial investment in the wonderful proxy means test and social registries, with 73% exclusion errors, the vast majority of the target population missing out. And this widespread, inaccurate, unfair, and arbitrary targeting fundamentally, in my belief, undermines trust in government, because you don't know if you're going to get it, even if you're poor, and you've already excluded the missing middle. Why are you going to trust your government? Therefore, it fundamentally undermines the social contract in these countries, which is why we have low levels of spending. And ultimately, the main beneficiaries of this are the rich in the region, who are paying very low levels of tax and able to send their money overseas, or live in luxury. And the vast majority are living in poverty across South Asia. Now we have the COVID-19 crisis comes on top of all of this and makes it even more challenging. Now, interestingly, while some countries, as 5 years going on, have tried to use their existing programs to expand them out, and the work we've done, I don't have time to show here, shows they still get very large errors in terms of who's benefiting, and many of those in middle incomes who are really being hit are being excluded from the programs. We are beginning to see signs, even amongst surprising actors in the IMF and the World Bank, of saying, why don't we think about universal transfers? What about putting in place life cycle social protection systems? We can see the Global Directive of Social Protection of the World Bank talking about universal social protection entitlements, reaching the missing middle. And of course, the United Nations, unsurprisingly, still calling for universal social protection as a key part and commitment of achieving the SDGs. Now, The choice then in the region, I guess, is in one way to continue when we're looking across the life cycle, providing protection for us against the risks we face across the life cycle, is whether we're going to continue with the existing prevailing poor relief model, which basically replicates the kind of social protection we had in 19th century Europe, and continue with this and undermine the social contract, or do we begin to build actually much more inclusive schemes where everybody can access social protection as a basic human right by giving every child access to a child benefit, everybody of working age access when they need it to key benefits like unemployment and sickness benefits, which are particularly important in the time of COVID-19, maternity benefits, survivors benefits, everybody receiving an old age pension when they reach old age, and providing comprehensive support with disability benefits right across the life cycle. Now, can we do this as an emergency response under the COVID-19 crisis? The work we've been doing with the South Asia, the UNICEF office, is looking now at what if we were to invest 2% of GDP in these countries, which is way bigger than the existing response in those countries, but it's actually a very small response, fiscal response. That would still be inadequate, well beyond what they're doing at the moment. Budget on par, it's more or less what Timor-Leste is planning to do in its its fiscal response. And what about with this 2% of GDP? For 6 months, we could give all children between $5 and $20, $5 in Pakistan up to about $20 a month in Sri Lanka. Every person with a disability between $20 in Pakistan up to about $50 in Sri Lanka, and every older person a similar amount. Amongst the older people in Nepal, we don't need to worry about them so much. They've got a great old age pension system there. It's only for those 60 to 65 that we need to cover in Nepal. So what would we get from this? Everybody being able to access the benefit. Now, the coverage, I think what we see is very high coverage. These are going to be very popular programs of important fiscal stimulus to get the economy going. We'd be reaching in most countries over 90% of the population. Only those who won't be getting will only be households of able-bodied working age people. We're getting up to 97% of households in Pakistan. Incredibly popular program, reach everybody and provide them with a really important transfer in this very difficult time that they have, and also importantly, a major fiscal stimulus to the economy. What would you see in terms of the impacts that this would have? So we've done lots of simulations. I can only show you one or two here. This is just an example across looking at the share of pre-COVID-19 consumption for each household. What proportion would they be getting? And we can see here, these would be very pro-poor measures in terms that those in the very poorest deciles would be receiving relative to what they got before the highest proportion of their consumption, up to almost 90% in India. But those in the missing middle, more or less, would be receiving between 10 and 30% of their pre-COVID-19 consumption, way more than they're getting at the moment through the existing fiscal stimuli that have been used in the region. We've done much more in-depth analysis in Sri Lanka, and there's a publication just come out on this. And in Sri Lanka, we've looked here at the actual impacts of COVID-19. We've simulated those on the population, and that's the red bars from 0. That shows the relative reduction in household incomes across from the poorest to the richest. Amongst those in the missing middle, you can see they're losing 30% on average of their incomes. Many, 40% of households actually in Sri Lanka lost all income in April. And then simulating in this 2% of GDP, what would be the incomes after that? And what we see in a really positive way again is amongst the very poorest, say the poorest 30 to 40%, will be receiving, either they would be recovering back to the previous situation, or amongst the poorest 10% would be doing 4 times better than they were prior. Those are missing middles. There would still be a very substantial reduction in the loss of income, which would be really welcome to those households. It's only amongst the rich where we would find smaller relative impacts on them. So this would be really positive measures that would help both those on middle incomes and the very, very poorest right across South Asia if they were to invest in this. And importantly, because this is also about helping households, helping families get by so they don't have to pull kids out of school, so that undernutrition doesn't increase, you know, so that we don't harm people's health, the family health. It's really important for that, but it's also really important for helping the economy. Now, the analysis we've done here using CGE models in Sri Lanka, quite a complex slide, but if you see the north in the middle, the red line in the middle, that's showing what the economy of Sri Lanka would have been like in each of the years up to 2038 without the if COVID-19 hadn't happened. So it's a sort of steady state. What we're seeing in the blue line is the actual impacts of COVID-19 on the economy in each year, and you can see that we're predicting, in line almost with others, that it would be, economy would be 8% lower. The existing mechanisms in Sri Lanka, and Sri Lanka has been, I guess, the country that has put most into supporting people through a fiscal stimulus program, would slightly reduce the impact in 2020 to about 7% loss of GDP. However, if you put in place the 2% of GDP, we're predicting in the model that you could actually get a loss only of GDP of around 2% compared to 2019, which would actually mean that Sri Lanka may possibly not actually fall into recession. The more interesting thing, though, is using this as the basis of building a universal social protection system right across, you know, a permanent system which begins to build the social contract, makes it that everybody at critical stages of their lives is able to access programs. And we simulate, what if we were to continue to scale it back, the program, but still provide 1.5% of GDP each year. And you can see the blue line would mean by next year, potentially, we would actually, the economy in Sri Lanka might be doing better than it was going to do, even without COVID-19, under a steady state. And over time, you can see that it would do better and better because of this long-term fiscal stimulus, injecting cash into the economy, taking it from the very rich who are not going to spend it, put it into the majority of the population who spend it, and we find there's very significant increases in economic growth, which means, of course, higher taxes, which means a country like Sri Lanka is going to be able to pay off its debt and invest in much better public services over time. Now, just for the last couple of slides, you know, I think let's look across the region. Do we see signs of perhaps somewhere possibly where we're beginning to see improvements in the social contract? I mentioned Nepal earlier as looking different, the poorest country with the highest government revenues as a percentage of GDP. Now here we've looked at government revenues across 5 countries in South Asia from 2000 to 2020, and you can see with the thin lines, red, yellow, purple, and blue, you can see that you know, they've bobbled along pretty much the same, very small amounts, not enough to deliver an effective state. But Nepal, the big thick green line, is different. It's actually doubled government revenue since 2000, despite being the poorest country in the region. And the one thing that characterizes Nepal that makes it different to other countries is that it's actually began to commit to universal social protection already in 1997 with a very small universal old age pension. And over time, as you can see here, I don't have time to go through it, has gradually expanded and built this universal social protection. Now, we can't predict causality, but it's interesting to pose the question, isn't it? That is there something to do with the fact that Nepal, despite having the weakest government systems in the country, in the region, has been able to build greater trust in its population by the fact that it's delivered these universal programs over time, often despite the opposition of international donors who've been trying to get them to target their programs, and always seen the benefits in much higher government revenues and potentially a stronger social contract. I say, I'm not saying causality, very difficult study to make, but let's remember, after the crisis of the Second World War, it was the investment in universal services, including universal cash benefits, that actually built the social contract in Europe. That led to high increases in government taxes and a much more peaceful and cohesive societies. Is COVID-19 the crisis that pushes governments in South Asia to follow the same path and begin to invest in universal social protection? So I guess the choice that South Asian governments have now is that they kind of need to choose between which approach to social protection do they want to have in the future. Do they want to continue with what I would call this second-hand larder poor relief system? I know Fabio said he doesn't like to see this as social protection as charity, but it is charity. It's given to the poor, very small benefits. Do they want to continue with that? They'll get something, but they won't get very far. Or do they want to move into now Rolls-Royce inclusive life cycle social protection? It costs more, but it gives you a much, much better system. One you can be proud of, one that will commit your citizens to pay their taxes and to feel part of the state, to increase the social contract. Of course, the Rolls-Royce may not be possible right now in Asia, South Asia, but how about the Toyota model? Bit cheaper, but I'm sure South Asia can afford it. And actually, in the context of COVID-19, they can't really afford not to do this. So is this the moment for change that we can see in South Asia? So I'll finish there, Louisa.
Thank you. Thank you very much, Stephen, and Alim and Fabio for the 3 presentations. There are several questions in the chat, so let me just start bringing some of these questions. A question for Alim from Pedro Arruda. You mentioned how colonial institutions, so just a minute, I will pose some of the questions to you. Please try to be concise because there are at least 5 questions, a couple comments that I would like to read from the audience. So, I mean, you mentioned how colonial institutions compromise human development in South Asia. What are good strategies to prevent that social protection itself gets exposed to the risks of falling under these dynamics and or under elite capture? So that's a question for Alim. There's a second question here from Samir Khan. If countries divert their health and social protection budget to fight COVID, how do they cope with other important priorities in health, child protection, and education? So the question wasn't directed at a specific person, but maybe if I can ask Stephen to comment on that. There's a comment here from Javed Tak. After the COVID unlocks, there should be created a policy for rehabilitation of persons with disabilities, along with a database so that persons who need support are catered during emergency situations, and persons with disabilities are not abandoned or lost. So let's just start with these 2 questions, and I'll leave the comment here. Perhaps Stephen can comment on that, but and then we'll move to a couple more questions. Alim?
Okay, yes, thank you. Yeah, that's an interesting question, but I think that part of that hasn't already been answered by what Stephen said. And that is to say that if a state actually starts investing in its citizens without any discrimination.
Alim, we can't see you. Just sorry, interrupt
okay.
you. Thank you.
Okay, yeah. Yeah, so I was just saying that actually part of the answer that the questioner has asked has been given already by Stephen, who's talked about why the current mechanisms of social protection actually create more discrimination and social incohesion because they are targeted. And the answer to that essentially is that a state that discriminates among citizens is not able to restore the social contract. So the answer again to the whole question of how do we really make the investment which leads to a stronger social contract is to say, can we do work that is rights-based, inclusive, and cuts across all the age groups in a way where people don't see any stigma or any discrimination based on ethnicity, nationality, or provincialism. And I think that is the answer to build the state in South Asia, as Stephen was saying, in terms of what needs to get done. And initially, I think there will be a lag where, of course, there will be a bit of an overspending by the state in this process, and there is always fiscal space available in terms of when we talk about, for instance, in South Asia, expenditure on defense. There is always fiscal space available to make new ballistic missiles for billions of dollars. But when we talk about social protection, there's always this issue about, oh my God, we don't have any fiscal space. So I think that we need to get our priorities right, and the biggest security that states can have is actually economic and social security, not security based on more defense equipment. Over.
Thank you. Fabio, would you like to answer the question on if countries divert their health and social protection budget to fight COVID? How do they cope with the other important priorities on health and protection, child protection, education, and so forth?
Well, there is an assumption that the social sector budget can only be allocated within the social sector budget. So as we saw, the COVID-19 is an emergency that reached the overall economy. So it doesn't mean that the extra budget, and many countries have voted extra budget recently. Some of them had actually to reform the fiscal rules that were sort of straitjackets in the expenditure in order to comply, especially with the health sector. So the health sector has always been the one that has been on the forefront of the response in terms of getting extra budgets. The other thing that's important is that we shouldn't think on the social policy as the social protection being something that doesn't have an impact on health, on education, and on child protection. So even though it's not part of that specific sector, the policies that are implemented by social protection sector actually respond to some of the negative consequences or the negative indicators that we see in the other sector. So we shouldn't think in terms of the social protection as being something that only increases the income and fights poverty of a specific family. It has other impacts in terms of the social indicators.
And so if I can just continue with you before moving to Stephen, there is a question for you, Fabio, on which South Asian country or country do you consider has performed best in their social protection responses to COVID? And what are the features that you consider have contributed to this performance the most?
I would say it's still early to respond, because now we can say that X countries, Y country was quicker in putting together, in allocating the extra budget to the health sector and to the social protection than other countries. But there is another question that's coming later that actually asks how the lockdown response was implemented by the countries and whether one strategy was more successful than the other. So I think that the challenge here is actually to see how the lockdown measures came in tandem with the response that some countries have implemented. So Aline comment, for example, the unrest in Nepal that took the streets. We saw what happened with the migrant workers in India with the short time that they had. They didn't have time to move and go back to their places. So in that terms, I think it's still a little bit early. So there has been, we can say, mismanagement of the implementation of some of these programs. But actually, we also need to acknowledge that the governments didn't know how the pandemic or the epidemiological curve would move. And that's why we had the live versus livelihoods debate. Some thought that the measures were taken without taking into consideration the volume of the response that needs to be taken to ensure that the livelihoods will be preserved.
Thank you. It's always wise not to pick and say which country did the best or the worst. So it was a good way to talk about how different countries put on different measures.
We have the coverage, we have the indicators, but how to interpret them, we need the context. So that's what we're still missing. The final history of the pandemic. We're still in the middle of the pandemic. South Asia hasn't reached the peak yet. So one thing that we need now, these measures need to be extended and at least until the end of the year to protect the population, because the containment measures are still in place if we look at the index, right? So people are still struggling to make the living.
And some of these measures are already being stopped in some countries, right? So, Stephen, there was a little the comment about creating systems to ensure that people with disabilities are protected, but I will also link to another question that is here for you on why do you believe that social programs and social protection programs in South Asia have such poor targeting? Is it a matter of technical limitation or a reflex of widespread poverty and overlapping vulnerabilities that make it very hard to actually distinguish between who deserves and who does not deserve to be covered?
Yeah, thanks, Louisa. So I think the first one on people with disabilities, I mean, I think clearly, you know, to be able to direct support to people with disabilities, you need good quality systems to be able to identify people with disabilities, right? And ones that do not themselves create barriers to access. So they're you know, zero cost to access. So you can identify people with disabilities and then be able to direct resources to them. In a situation like we're seeing COVID-19, if countries had in place already universal disability benefits for children, you know, people of working age and old age pensions for people with disabilities of old age, you'd have had a much more effective response. You could have just increased those schemes and reach them. The fundamental problem is we can talk all about the wonderful things of giving, you know, helping people with disabilities, doing this, helping getting jobs, etc. But if we don't resolve the problem of the social contract, we will not have the government revenues in place to be able to invest in programs for people with disabilities, for children, for you know, single mothers, for older people. They just won't be there. So we have to resolve that fundamental issue of the social contract, increase government revenues, then we'll be able to have the resources to put in place high quality programs that that citizens want. So in terms of the question on the targeting, I mean, I didn't actually mean to say that, you know, South Asia had necessarily worse targeting than anywhere else in the world. I mean, I think, you know, it's pretty much on a par with most other low and middle income countries. Exclusion errors above 50% are the norm. We find even in Latin America, in one country, errors of 97%. You know, there's been a lot of investment in targeting systems, particularly these so-called social registries. They don't improve the errors in most countries in terms of the targeting errors. It's incredibly difficult. One, because, you know, people think of them very, very dynamic, and you know, across 90% of the population, there's not that much difference. Most people are living in poverty. So it's incredibly difficult to target the programs. You will get very, very high errors. You could probably do it a bit better, but you're still going to have the very high errors. And it requires a fundamental shift in paradigm to move, as we did in high income countries and as perhaps Nepal is doing, to actually move to more universal programs and then reduce the errors. So in Nepal, with the universal pension, we'll probably find very, very small errors. They're very, very limited exclusion, and the rest of South Asia find very high exclusion. So South Asia is not worse. It's just impossible to do. It's about a paradigm of poor quality social protection based on charity for the poor, while the rich then can pay low taxes and enjoy private services for themselves. And this is why it's fundamentally getting back to the social contract. Improve the social contract, improve government revenues, we get more universal programs, and we get better targeting for everybody.
Thank you, Stephen. There was one comment that I want to that was here in the chat box, and one final question before we wrap up. A comment was that from Firoz Alam. Poor governance in most of the countries in South Asia is one of major challenges as to implement effective social protection programs. Eventually, government lost trust of citizens. So, and there was one question on the social protection response of governments in South Asia. Typically, we see the proliferation of safety nets in the form of cash, school feeding, vouchers, etc. Referring to the social contract comment one speaker has made on the delivery of services, which have been severely underfunded by South Asian governments, have any government considered using fee waivers for health, education, and nutrition services as part of their social protection package? Maybe Fabio can respond to that one. since you've looked at the different responses in the region. Sorry, you're muted. You're muted, Fabio.
For the health sector, yes, because the COVID-19 is a health crisis and a health issue. So in most countries, one of the measures was to allow free treatment. So the quality and the reach of this free treatment is an issue. For education, the challenge here is that many the schools are closed. So and here we have two typical social protection response, and actually in South Asia that was not widespread. Perhaps the exception here would be India and Bhutan, was actually to convert the school feeding in take-home ration in-kind transfers for the families as a response. But here we will have a challenge when the schools resume and to make sure that children go back to school, even when it's not normal anymore. So to catch up with the learning that has been lost, but also to ensure that children go back to school is going to be one of the challenges in which social protection can be also helpful in ensuring that children go back to school. But the measures that were cited, they are all classified as social protection. If we take, for example, the CODI Institute's classification. So these are also part of the social protection. But the risk here is that in general, the governments take the expenditures, the fee waivers and all this as to justify a little bit not having in place income security programs with a life cycle approach. So we need to be, so if one of the problems is having a fragmented social protection with low coverage programs everywhere. If we add these, we can just be more of the same instead of going for a more comprehensive system integrated around income security, as the social protection law predicts.
Okay, so thank you. And I have a question that relates to how I introduced all of you, and you have 5 minutes between the three of you to answer, because then I just want to wrap up. So the question is, how, for all three of you, and then maybe we start in the order from Aline to Fabio to Stephen, how does the COVID-19 crisis move the needle or changes some of your expressed frustrations, well, that I expressed for you on the work on social protection? So particularly for Aline, the fact that you feel that politicians and decision makers don't take it seriously. For Fabio, the fact that you feel that people still look at social protection as charity instead of the investment that it is. And for Stephen, the good old argument that there is no fiscal space, that countries are too indebted to invest in universal social protection. So if each of you can answer in about a minute and a half, how you think COVID can potentially change these limitations. Aline?
Yeah, I think that just combining this and another question that we had, I think it's easy to say that, but perhaps more difficult to implement. The question that I usually ask myself is, being from South Asia, is why is policy process so difficult in South Asia in terms of state building, and how can we improve it? And if you link it back to the social contract and social protection issues, I think one of the things that is of real interest to me is to see how we can possibly make the participatory process in our democracy more empowered by allowing people to access predictable, inclusive social protection. So I think that our decisions in democracy are not high quality because people are constantly working day in, day and night out to save themselves in terms of just getting the next meal. And in that process, you can't really actually have good participative democracy. And I think if the state is able to provide some sort of predictable monthly income to people, they will have more time to think through what they are doing with their votes and how can they actually take participation in local and general participative governance. And that should improve to a certain extent the political question that you have in why do we make bad political decisions and not really invest in where we need to invest. And I think that to me perhaps is the answer to both questions, both in terms of my frustration and also to answer a question in terms of how governance is why deficient in South Asia. Over.
Thank you, Fabio.
That's a difficult question, actually, because I think there was this sort of optimism when governments started replying to the crisis and start using or expanding social protection schemes that were already in place. I think that another source of optimism is what Stephen has showed in his presentation, and the change in the IMF and the international financial institutions saying that, look, that's a different crisis, we need to do things differently, and they started supporting more universal cash transfers. And the implication for that in terms of the crisis is that the governments would need to increase the debt levels, and they would need to reform the tax system. And that relates to what Aline is saying about the social cohesion, at least for the tax system. For the debt levels, it also has to do with the credibility in terms of the international market and the ability of the government to get external resources to finance the needs, the huge needs with the current crisis. But I haven't seen any commitment at the level that's necessary at the international arena to support countries, to support low middle income countries and low middle income countries to do it. So if we look at now the international rating agencies, they are downloading most countries, and the countries are not going to get loans at low interest rates. And at the same time, even though the tax reform are important, in the middle of a recession, it's not the moment to do the tax reform, and there are many of internal interests going on. So the countries haven't been allowed to have the breathing space in order to implement these reforms. And with these reforms, try to increase the social cohesion. So I got really excited in the very beginning. Then I was depressed 2 weeks ago. So I'm leaving the depression now, trying to see what's feasible to work on this and keep it advocacy to show that social protection is actually an instrument to build social cohesion and to avoid the worst effects of crises like COVID-19 that are likely to become more frequent. Thank you.
Thank you, Fabio. And Stephen?
Yeah, on the question of fiscal space, I mean, I think it's disappointing often, where, you've got this incredible, this catastrophe happening economically with COVID-19. You still get the same people saying, oh, there's no fiscal space for an adequate fiscal response, right? That's no longer appropriate. When your economy is crashing, when a very high proportion of your population doesn't have any money to be able to afford food, you can't say there's no fiscal space. You have to get the fiscal space. You have to find it. And what we find in high income countries, they're doing whatever they can to find the fiscal space with very high levels of fiscal response, above 6% of GDP. There needs to be something different. And potentially now, I think you'll never find the fiscal space for programs for the poor. There never is the fiscal space for programs for the poor because those programs are unpopular. Nobody wants to pay taxes for programs for the poor. So you'll never have the fiscal space. The difference now with COVID-19 is a crisis that's hit everybody. Everybody's been potentially hit. Ambitious, forward-looking governments might now realize actually they can put in place programs for everybody and that they will find the fiscal space. And we need to stop this talk because it comes up all the time. In December, as you know, Louise, in Sri Lanka, there were big tax cuts for the rich in income tax, big tax cuts. There was the fiscal space for those tax cuts, but apparently not the fiscal space for an appropriate response for the majority of the population who didn't benefit from those tax cuts. It's about a big change. It's about everybody understanding, yeah, we're willing to pay more tax. We're going to do it. And moving from this very low tax environment in South Asia, where the highest taxes on the rich is about 30%, getting down to about 18%. I'm paying more than 50% in tax, and I don't mind because I'm getting good quality services. Danes and Swedes are paying much more than that. They're getting good quality services. We need this fundamental change, and then we'll find the fiscal space if programs are there to benefit everyone, and then we'll all be willing to pay our taxes, in particular the rich, who will benefit from much better societies in which to live and better markets for whatever they're selling.
Thank you very much. So thanks everyone for being here. As you saw today, one thing that is very clear is that the responses in countries in South Asia, how systems adapted, how systems expanded, they did not happen in a vacuum, right? The pre-existing conditions in the countries both dictate what responses they put in places and what responses they need to put in places. And as we saw here, the social contract in countries in the region is quite weak. And the COVID, why do we say that? Because we see the low level of financing of the state by the citizen and of services for the citizens by the state. The low levels of tax to GDP ratio, the low social expenditure. So it really begs the question, how can we build a nation state with such low investment on each other and such low trust in each other? And when the COVID crisis comes, it really exposes all these weaknesses, all these rising inequalities, the social fissures that already existed, and really highlight the urgent need to forge a new social contract. And that so that we can move from the vicious cycle of low taxation and bad services to the virtuous cycles of higher taxation and better services. And social protection is one of the key tools at the disposal of governments to make that happen. And I think there's a common thread among the three panelists in their work always, but in their talks today. So Fabio and Stephen have brought us some evidence that this crisis will most likely linger around for a while. It's not going to follow a V shape where it's going to disappear just as abruptly as it appeared. It's going to be among us for a while. And that necessitates smarter thinking from the parts of governments, from the parts of development partners, IFIs, and civil society on what it is that what we do now, what we can do now, but that will build for the future. Because unfortunately, this is an unprecedented crisis, but it's not going to be isolated. We have lots of crises coming due to climate shocks and the forth. So really, what we are trying to say here is that this idea of never wasting a good crisis, hopefully COVID will be a game changer for social protection, and social protection, as Ugo mentioned, Gentilini from the World Bank said in one of his talks, and the vice versa as well, and social protection will be a game changer for COVID. But that's not automatic, and that we cannot take that for granted. We need to continue working with governments to really have this paradigm shift that Stephen is talking about, on stop thinking of social protection as a charity and start realizing that right now, yes, countries in the region are in a very difficult fiscal position, and that's why it's more important than ever to really be stingy and worried about how am I going to spend the money. I'm indebting myself, I'm printing money, I'm taking more loans. I really need to invest on something that is going to give me returns. And the extent to which countries can do that will show a difference in the short and medium term. And I think we need to continue working with governments to support evidence-based policy. There's a lot of work that IPCIG and Development Pathways have been doing with UNICEF and beyond, but that is really showing that what investing in universal cash transfers, for example, for all children, for all people, older people, for all people with disabilities, that is not just something that protects lives, It protects livelihood, but it protects economies and helps to kickstart an economic recovery. So I think this is definitely the time for us to continue this conversation, and certainly not take for granted that now everybody's looking for a new normal. Not necessarily. I think as we start to go back to the normal, and if everybody's saying let's not go back to normal, let's build new normal, that's again that's not our fate. People are tired. People want to go back to normal. People just want to be doing what they know, and change is not easy. So I'm happy that we're here having these conversations. I'm happy that socialprotection.org will continue to put conversations, really interesting webinars, and I again invite everyone to join and to sign up to socialprotection.org to stay up to date with what's happening in the world of social protection, and particularly how COVID is changing and shaping the world of social protection. So thank you once again, Alim, Fabio, Stephen, thanks everyone from Social Protection, and thanks to all who have joined from all different time zones. Have a good, for me it's evening, but have a good day for everyone. Bye.
Thank you. Bye.